Present.
Andy H. Quinn, Commissioner Precinct 2.
Here.
Gary Vickers, Commissioner Precinct 3. J.D. Johnson, Commissioner Precinct 4. Constitution Quorum.
Thank you. Our invocation this morning will be delivered by Pastor Darius Johnson from Christ Church Assembly of God in Fort Worth. We appreciate very much you coming out this morning. After the invocation, please remain standing for our pledges.
Thank you, sir. Shall we bow? Heavenly Father, we thank you for the opportunity today to pause and recognize your influence in the affairs of man. We thank you for the leaders that you have given to this community to guide us with your favor and with your wisdom. As we pause this morning, we ask for your continued favor and your continued wisdom. May you grant our understanding that it is not simply by human talents or abilities, but it is by your influence that peace and prosperity comes to every community. For we ask this in the name of your Son, the Lord Jesus, and for your glory. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the precious flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
Thank you, Pastor Johnson, for being here today.
Thank you, Judge.
I'm here. Agenda announcements.
Members of the Court, we have one announcement as it relates to the agenda today. That's on the administrator section. It's item 8A1. We're going to hold that for today. We are waiting word from Department of Justice on some funding elements as it relates to cost per hour. It's our intent to finalize those discussions with DOJ and have this on the agenda for next week. Your Honor, I might also note that with that being removed from the agenda, the administrator section is all consent.
Thank you. Court members, you have before you the minutes of our regular meeting of March the 13th.
Move for approval. Second.
We have a motion, a second. Any discussion? Please vote. Commissioner Fickus, you need to. Motion passes unanimously. We have two items under our proclamations and resolutions area. The first is a certificate of appreciation, and I believe that Savala Swanson from Facilities is going to be here to accept that. Come on forward, sir. I'll read that into the record. Whereas the annual electricity cost to operate the Tim Curry Criminal Justice Center has been reduced from an annual total cost of $931,375 in 2008 to $674,486 in 2011, which is a 28% reduction in annual electricity costs. And whereas the Facilities Management Department team of Savala Swanson Jr., Frank Lopez, Sandra Sosa, Persia Parker, and Brian Harris assisted with successful completion of energy-saving capital improvements for the building from 2008 to 2011, including replacement of the electronic building automation system, installation of office light occupancy sensors, and installation of high-efficiency HVAC chillers and water pumps. And whereas starting in 2011, Tarrant County and the state of Texas employees and elected officials in the building doubled their efforts to save energy by turning off lights and computers when not needed and raising the room thermostat settings in the summer. And whereas the savings on electricity cost realized from the efforts of the facility management staff, employees, elected officials for the years 2009, 10, and 11 totaled to $412,733. Now, therefore, we, the Commissioners Court of Tarrant County, do hereby present this certificate of appreciation in recognition and appreciation of the many activities of the facility management staff, Tarrant County, and the state of Texas employees and elected officials to lower the energy cost in the Tim Curry Criminal Justice Center. In witness thereof, we've heretofore set our hands and caused the seal of Tarrant County to be affixed this 20th day of March 2012, and I'll move its approval. Please vote. Motion passes unanimously.
And I believe that the others who
Y'all
are
come on down.
mentioned in the
Yeah, that's pretty.
resolution are also present.
That's remarkable savings.
Come on, Ms. Persia.
We'll let you stand in the middle with the picture. Come on around here. Here we go.
I'm impressed.
As you said, that is pretty amazing when you look at how much of a decrease that is. So, again, thank you all very much for your efforts. Mr. Phillips, thank you, and your department for everything that they do in that area. The next is a proclamation on Poison Prevention Week, and that is for ratification only, and so I'll move its approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Court members, you have before you the consent agenda.
Move approval. Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Auditor, Ms. Tidwell.
We have two items for the court's consideration this morning. The first is to approve an updated general depository agreement between Tarrant County doing business as Tarrant County Housing Assistance Office and J.P. Morgan Chase Bank.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
And our other item is to ask the court to receive and file the auditor's report of the district clerk's delinquent tax section. Just point out just a couple things. This is the first time this area has ever been audited since I've been here, and I believe prior to my time here. It's a very complicated area. It takes a long time for those tax cases to work their way through the judicial process. The system in place is also been there a long time. It's been there 20-plus years. So while we have several findings, we appreciate the efforts of the district clerk to do what can be done with the resources that he has, both staff and system-wise. But there are some areas that we think need improvement as outlined in the report. The clerk is in agreement with the auditor in most all important areas, so I'd be happy to answer any questions.
Move to receive and file. Second.
We have a motion and a second to receive and file. Any discussion? Please vote. Motion passes unanimously. Mr. Wright? Later. Ms. Glenn?
Good morning.
Good morning.
We have several items for the court this morning. The first item, we're asking the court to receive and file the personnel agenda.
So moved.
Second.
We have a motion and a second. Please vote. Motion passes unanimously.
Second item, we're asking the court to approve our 14th annual Tarrant County Employee Picnic at Six Flags Over Texas. Specifically, what we're asking the court for is permission to pay a 10% deposit, which is approximately $5,617.50. What this deposit will do is it will hold our date for us, which will be Sunday, October 7th. And that's our request for the court today.
Move for approval.
Second, this has turned out to be an extraordinarily popular event among Tarrant County employees.
It has.
I have a motion and a second. Any further discussion? Please vote. Motion passes unanimously.
Item number 3, we're asking the court to approve a revision to the table of organization for Precinct 3 to reclassify an executive assistant position. We're asking the court to approve this reclassification effective May 1st.
Move for approval. Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Our fourth item, we're asking the court to approve a waiver of terminal benefits for the district clerk's office. The district clerk has a lead criminal appeals clerk who's going to be leaving county service at the end of March with 198 vacation hours. The waiver will be offset by salary savings, and so we're actually looking at a savings to the general fund of approximately $2,200.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Our fifth and final item is also a waiver of terminal benefits for Precinct 4. Precinct Administrator is going to be retiring at the end of March with 400 vacation hours. The fiscal impact to the Road and Bridge Fund is a little bit more than $22,000.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Thank you.
Thank you. Mr. Beecham?
I'm
Good
not
morning.
wearing blue today.
Sir?
I'm not wearing blue today out of respect for you.
Go right ahead.
That Kentucky stuff.
We are a zero seat as of today, but we have three items for your consideration this morning. Our first item is a bid award recommendation for bid number 2012-049. This is our annual contract for toner cartridges for inkjet and laser printers. Our recommendation would be to award on a per enterprise basis, awarding to the primary, secondary, and alternate vendors meeting specifications. That last year's expenditure is about $366,000.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Our second item is another bid award recommendation for bid number 2012-050. This is a bid for the Tarrant County Juvenile Detention Center Wall Distress Repair Project. Recommendation would be to award the low bidder, Bryco Bryant, the amount of $49,270. If this is approved, we're seeking contract approval as well as acceptance of the performance and the payment bond.
Move for approval.
Second.
We have a motion and a second. Discussion?
Yeah. Jack?
Yes, sir.
Any particular reason why you got one bid that's substantially low and three bids that are kind of way on up there?
We've checked that out. This is a vendor that's done quite a bit of business with Tarrant County in the past. They are aware of the project. I asked the same question myself, and we're comfortable, as is facilities, with the bid that was submitted.
Okay. And they're bonded. This is a bonded
Yes, sir.
job. Yeah. Okay.
Any other discussion? Please vote. Motion passes unanimously.
And our last item is another bid award recommendation for bid number 2012-062. This is our annual contract for custom file folders for the district clerk's office. Recommendation is to award to the low bidder, File America, on a per unit price basis. File America is located in Fordyce, Arkansas, the boyhood home of Bear Bryant, and the Fordyce High School Redbugs.
Is it conflict of interest? They got anything to do with it?
You're not going to get a motion. Take that back, and I'll make a motion.
I'll take it back.
Second.
We have a motion and a second. Please vote. Motion passes unanimously.
The Bear would be proud. Thank you.
Commissioner Brooks, I believe you have an interlocal agreement.
Yes. I move approval of the interlocal agreement and the permission to start items J1 and 2,
J1, A, and B.
1A and B.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Commissioner Wynn?
I move for the approval of the interlocal agreement on item J2, A, and B, please.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Are there any appointments today? Being none, then you have before you the claims and the addendum.
Move approval of the claims, including the addendum.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Briefing items, Mr. Manius.
Thank you, Your Honor. Members of the Court, we have three items to bring to you this morning. The first one concerns the expanded food and nutrition education program, which will be presented by Texas AgriLife. Ms. Mayed and Ms. Cody will be here to make that presentation.
Good
Good morning.
Good morning.
Morning.
My name is Nicole Cody. I'm an extension agent with Texas AgriLife Extension Service, and I'm here with my coworker Darlene Myatt, and we're representing the Expanded Food and Nutrition Education Program, or we like to refer to as FNEP because that's a big mouthful, right? The Expanded Food and Nutrition Education Program has been around for a long time. It's a national program. It's federally funded. Here in Fort Worth, we teach nutrition education series to limited resource families and youth within Fort Worth. Our goal is to give them the basic nutrition education that they need to create healthy meals for their families so that they can live strong and healthy lives. We teach basic food group information about food safety in the home, how to stretch your food dollars, how to prepare healthy meals as a family, and physical activity in the homes. We go out into the community and we teach our classes all over. We teach in schools, community centers, churches, private homes, anywhere and everywhere a group would like to meet. We have a hands-on learning approach. It's learner-centered, where they are able to interact with the educator. Our educators are paraprofessionals who can easily relate to the target audience. All of our information is practical and research-based. We've now switched to My Plate. We used to teach My Pyramid, but as of June of last year, the USDA has implemented the My Plate icon. And we're supported through a lot of Tarrant County partnerships, either the City of Fort Worth ISD, community centers, churches, Boys and Girls Clubs, after-school programs, many partnerships that support us. During our program year last year, 2010-2011, we have expanded our adult outreach of the program to 926 program families, and 63% of those adults graduated from the program, meaning that they completed at least 6 hours of nutrition education. Our classes are an hour and a half long for 7 weeks. We do a short lesson series, so we do our short lesson. We do food demonstrations where the participants are able to taste the food and take home their recipes, and then we do a physical activity portion in the classes. From those that graduated, you can see here that the majority of them improved their food resource management practices, either taking a grocery list to the grocery store, planning their meals, not running out of food before the end of the month, saving money at the grocery store. 73% improved one or more food safety practices. The majority of them are amazed to learn that we do not need to defrost meat on the kitchen counter. And then 89% of them improved one or more nutrition practices. Our goal is to improve or increase fruit, vegetable, and dairy intake. And finally, from the adult component of the program, 34% reported a positive change in physical activity. Our goal is to get our audiences active and moving for at least 30 minutes every day.
As Nicole mentioned to you earlier, I do have responsibilities for coordinating nutrition education activities for the youth component of FNAP. As you can see from the information provided, we're very fortunate to have established partnerships with a number of the local agencies and organizations in order to expand our outreach this past year to over 12,000 youth. Most of my time, to be honest with you, is spent in the classroom to support Fort Worth ISD's Coordinated Health Project, which was mandated by the State Senate in 2006 to address concerns over childhood obesity. So for that reason, we not only offer programs, as Nicole has mentioned, classroom programs for the children. We get the parents on board because we know we're not going to make as much of an impact at home if we don't get the parents to buy into making better choices for the entire family. To reinforce that information, we typically will offer programs as far as after-school projects, and then to keep the idle hands busy during the summer. Again, we network with other partnering agencies to offer summer outreach programs. We do have, as part of our lesson series, a built-in assessment done as a pre-test, post-test to address some of the program indicators. And as you can see here, of over 12,000 children that were reached this past year, 74% of those students are now eating a variety of foods based on USDA's My Plate. We are As Nicole mentioned, on June 2nd, we started to make that transition. Hasn't really been that much of an issue because the kiddos were already familiar with the food groups that make up my pyramid. It's just a matter of using those food groups to serve a more healthy plate. So the transition has gone very smoothly as we continue to work to increase their basic nutrition knowledge, which in this instance was enhanced by 82%. We do also like to promote and encourage the kiddos to look at the nutrition facts label in order to make more healthy, low-cost decisions when it comes to food buying, because we know they too sometimes have an impact in decisions that are made. If transportation is available, as it was this past summer for a special project with the Young Women's Leadership Academy, they went to one of the neighborhood grocery stores after developing an actual shopping list of foods that were needed for a workshop that afternoon. They did their grocery shopping. They made sure everything balanced out. Really good hands-on practical experience for them. We also like to promote the use in working through the partnership with Tarrant County Public Health, making sure that the families take advantage of fresh produce from our local vendors, working with them to, in this case, buying fresh asparagus, which many of them, they noticed when we gave them vouchers that were issued at Kids Fest, they immediately took advantage of things like tomatoes, greens, things they were familiar with, but asparagus was something a little foreign. So that gave us a little cue as to these are some things that we can use as a teaching moment. But we will be working in June, once again, in partnership with the Public Health Department to promote Live a More Colorful Life with recipe demonstrations, again, to encourage them to kind of think outside the box and address the need for increased fruit and vegetable consumption. Hands-on cooking, that's always a favorite among the kiddos. Teachers like it because that's a perfect way for us to address simple tasks, especially working with fractions, math concepts, things that we used to think of were compatible with TAKS, and now it's the STAR test. But kiddos enjoy that. We know that many of them, if they do not have appropriate supervision at home, may actually be doing some cooking. And for that reason, we do include some hands-on cooking, which helps their safe food handling practices, in this case by 94%. And once again, as Nicole mentioned, we want them to get up and get moving. Lots of emphasis placed on that. As part of the Fuel Up to Play 60 project that we are also promoting, walking can be really cool. So that's why some of you may have noticed that you have pedometers, because every step counts. Whether you're able to devote a full hour, 5 minutes is better than no minutes. So we just encourage the kiddos to not only think in terms of their own health and well-being, but to involve other family members. That's right, that's what you have there. The Diamond Hill community in this example was really good to get the kids up and moving before the weather got so hot in the afternoon. This also lends itself well to support some of Extension's other projects, including Walk Across Texas and the Walk to School program. We do know, as a nationwide effort, that we are making a difference in the lives of families based on research conducted. We know studies shown that, as you can see here, for every dollar spent on FNEP represents a cost savings of $10 in healthcare costs, with $2 saved by program participants. We've taken it a step, once again, a step further. For Tarrant County, this means a cost savings of $3.2 million in healthcare costs and over $600,000 in food costs for the participants that are enrolled. We're very fortunate. I get to work with lots of cute little kids throughout the inner city communities of Fort Worth. We do work to make the best better. In this case, we like to involve them in any of our 4-H projects to expand their learning experiences, as well as, again, working with the families to strengthen the family units. But if you have any questions, Nicole and I will be happy to answer them. We do appreciate the time to have an opportunity to visit with you, share some of the things that we're doing with Expanded Food and Nutrition Education Program.
Any questions? Very much. Thank you very much for your presentation.
Thank you.
Appreciate it. Thank you, Nicole.
Members of the court, if we could go to item B. This concerns a report from the Public Health Department concerning STD HIV program activities. Mr. Wilson is here to address the court at this time.
Good morning.
Good morning.
Morning, Mark.
Mark Wilson. I'm the program manager for Adult Health Services. And the first thing I'd like to tell you is that Adult Health Services in Tarrant County is unique in Texas. The simple reason that we not only do STD HIV disease intervention, but we also handle all of the HIV prevention. We are the only program in the state that is dual activities in terms of what's going on. I'd like to give you some numbers. for where we are. The pieces of the program are considerable. You have the STD side, which is doing the disease intervention, doing the interviews, doing the contact tracing, contact elicitation, the follow-up. You have the HIV prevention side, which is working with the client to make sure that they don't become infected. And our numbers for Tarrant County, as you can see, you had more than 7,000 cases in 2011 for chlamydia, 2,000 cases of gonorrhea, primary and secondary syphilis, 121 cases, and that's the infectious stage of syphilis. Early latent, 132 cases. But if you look at that last column, that's the percentage of individuals diagnosed under the age of 25. That spells a problem in terms of we need to reach the youth in the community. And there's a lot going on to try and do that. Case investigations, we handle all of the laboratory reports from every private physician, every hospital, every laboratory within Tarrant County. Anyone who is positive for any infection, that report comes to us. We determine if this is a new infection to be followed up, or if it's a previous infection where there's nothing needed to be done with that. And again, 33,000 reports came to us last year, which is a tremendous amount. And that's all being done, well, the majority of it is being done electronically now, as opposed to getting the hand paper that we used to get. You also notice that we conducted 470 syphilis and HIV interviews for the year. This is down a little bit from previous years. The high year since, I think, 2000 was 2010, when we had an influx of cases between Dallas and Tarrant County. We worked together to get that down again. Unfortunately, Dallas is now seeing an increase in syphilis and in HIV, and so we're working with them to make sure that it doesn't happen in Tarrant County as well. And you'll notice 106 individuals were preventatively treated for syphilis, which means that those are the individuals who were exposed to a disease, but because we got to them in enough time to prevent them from developing it, they did actually not develop the disease. So that's a savings of about $1.5 million in Tarrant County dollars in hospital expenses that we were able to prevent and save. One of the things that we're using to try and reach that youth population, we've tried a lot of avenues over the years, and working with Commissioner Brooks's idea in terms of the PRIDE program. And this is unique because what PRIDE does is we can't get into the school system directly. What we can do is work with the before and after school programs, Boys and Girls Clubs, Girls Inc., a lot of different organizations where the youth congregate. And what we are doing is we are training their leaders to give them the STD, HIV information, to give them the additional skills that they need to help develop the self-esteem, the awareness of STDs and what's going on in the community. And to date, this really got off the ground in 2011 in terms of training the trainers. We worked with the Emoja Group out of the Fort Worth ISD. We worked with Boys and Girls Club late in the year. And to date, we have trained almost 150 youth leaders to pass on the STD HIV information. And classes have begun with primarily Boys and Girls Club and Girls Inc. as well out of Arlington to actually deliver these classes. And that's been happening. We've had UNT Health Science Center do an evaluation assessment as to their knowledge and skill levels, and it's actually working well. Now, we're not going to see the results of this for a while because it takes time to really bring down the disease incidence. But the other piece of what we're talking about and why the Tarrant County program is so unique is that prevention piece. And I'm going to have Brian Barron, one of our first-line supervisors, come up and explain to you a little bit about what the HIV prevention piece consists of.
Good morning.
Good morning, Your Honor, Commissioners. My name is Brian Barron. I am the HIV Prevention Supervisor for Tarrant County Public Health Adult Health Services, the part of our program that is responsible for exactly that, HIV prevention. We have four primary components of HIV prevention. The first is our counseling, testing, and referral, which is exactly what that means, counseling and testing and referral for HIV. The first part of that is our protocol-based counseling testing, which is looking towards individuals with high risks, trying to figure out how we can reduce that risk in a short time. The next is our testing without counseling, which is generalized screening that we do in the community for individuals on a general basis, health fairs, any kind of street outreach that we conduct. 720 of those tests were done in 2011. The third type of testing we do is our expanded testing project, which is primarily done in the jail setting for individuals who are incarcerated. That was 2,204 tests. Now, the whole purpose of testing for HIV is to obviously inform individuals of their status, but more importantly, to find unidentified HIV cases, which we did find 81 positives in our testing efforts. Now, although this number looks great, it's even more important to get these people into care. The reason why we have the HIV problem is because people who are positive are continuing to spread the infection, and it's primarily because they are not in care. So out of those 81, we achieved 96% of entry into HIV care. So that's fantastic. The next component of our prevention program is our comprehensive risk counseling services. Our CRCS program is a long-term risk reduction program that gets individuals who are HIV positive and or of our target populations who tend to acquire infections more frequently so that they can look at specific risks and reduce those over time. We had 90 clients in 2011, and among those 90 clients, there were 483 interactions by our 2 staff in a one-year cycle. Now, what we like to do with these clients is obviously graduate them successfully so that they hopefully have long-term risks in hand. As part of those, we do ask the service to kind of see how they're feeling, how they did in the program, and give their impression of the program itself to see where improvements can be made, what things are being done well, and to receive any constructive feedback about how it can be improved down the road. Well, out of those exit surveys, we received 0 negative surveys, meaning that the program is very well received among all of our clients and is actually making quite an impact. Our third component is our evidence-based interventions. Our EBIs are class-style programs that we conduct on group levels in high-risk venues. Again, in the jails, drug treatment centers, halfway houses, where those individuals are known to be at and contracting infections because of their behaviors. We have 2 evidence-based interventions that we are currently doing. And in 2011, the first one was our sister-to-sister program, which targets our African-American females, which is one of the highest groups for contracting HIV currently. We had 34 sessions done in 2011. With those 34 sessions, we had 387 clients. That accomplished 156 were target population for African-American women for 104% of our target population for our grant requirements, which is incredible. Our next evidence-based intervention is our Turning Point program, and that program is targeting intravenous drug users who are either currently using and sharing or who have used in the past. And again, that's another high risk for contracting HIV. We have 31 sessions done in 2011. In those 31 sessions, we had 341 clients. In those 341 clients, there were 102 of those that were IDU for that target population of that, and it encompassed 89% of our target population's grant requirements. Our fourth component for our prevention program is our social network services. This is a fairly new program, only been in existence for about 2 years, and we are in our 3rd year of the 3-year pilot funding for this program. The idea behind this program is that individuals who are high risk, especially HIV positive, they have a social network in place of people who are also engaging in those risk behaviors. If you find one positive, chances are they know someone else is positive who does or doesn't know their status. Only way to get to them is to have some way of getting into that group by a peer so that we can get those individuals tested. Otherwise, they wouldn't come to us unless we go to them, or they have someone that they know very intimately that'll get them to test. We had 53 of those recruiters. These are individuals who actually become part of the program, and from there, they network with all of their associates to get them in for testing. From those 53 recruiters, we had 346 named associates. That was 173% of the target we were supposed to hit for the grant. Of those named associates, 173 of them tested for 192% of the number we were supposed to hit for our grant. Now, again, the purpose is to find HIV cases that are unidentified. This number shows the total number of HIV cases we found among those associates tested, 34 for a 19.6% positivity rate. It's astronomical. Now, there are previous HIV positives in this group. However, a lot of those previous positives were not in care. And like I mentioned earlier, if they're not in care, they run a higher risk for transmitting the virus. So, of those total HIV, we had 9 new HIV cases identified for a 5.2% positivity rate. I'm not sure if you're aware of what the positivity rate is nationally, but it's about a 1% to 2% positivity rate. So as you can see, this blew that number out of the water. So that made us number 1 in the state of Texas for identifying new positives for this program. Now, in that closing...
Let me back up and ask
Yes, sir.
a question. I'm not sure that, I think we want to be proud of the fact that we're number 1 in identifying it. But I guess the question that I would ask is, are we finding a higher incidence of HIV positive in Tarrant County than we are in other counties from that perspective?
Generally, no.
Okay.
Overall, we are not.
So we're just simply, we're doing a better job of identifying.
Correct.
But we're not necessarily having a higher incidence
Overall.
than what we would see in other, okay.
Exactly.
And we do want to be proud of that number.
Correct, because these programs are obviously targeting those higher risk factors, those higher target populations. So you hope to find more infection because if you're doing the right job and you're looking in the right places, you should find more infection.
Okay, thank you.
And with that, in closing, let's all remember that an ounce of public health is worth a pound of health care.
Thank you very much.
Thank you, Commissioners. Thank you, Your Honor.
There are still, Mark, you come up too. Thank you for mentioning the PRIDE program. It is beginning to work.
Yes.
But based upon the chart that you displayed showing the incidence of STDs and the age rate at which they occur, we've still got a lot of work to do. How do you suggest that we improve outreach services to kids so that we make a greater impact on that rate of STDs?
Well, I think we're actually starting to do that because we're expanding PRIDE. We've contacted Hope Farms. We've contacted several other organizations in Tarrant County and as well as some other areas in the county. Do some more things in Arlington, see where we can actually put this program to make it useful and beneficial. And we're starting to get some feedback from the public school system that they're asking on an individual basis, we would like to have this information for our students. Okay. So we're making inroads. They're slow, it's a slow process, but I think we're actually doing it.
I'd like for you to, as we go through the budget process this year, to take a look at where we are with PRIDE and other such interventions and make recommendations as to where we need to be budgetarily on expanding those programs.
Yeah.
And in terms of HIV and AIDS programming, how is the Public Health Department collaborating with community-based organizations to leverage our tax dollars in reaching out and educating and screening and testing and counseling and that sort of thing? Would you comment on that, please?
Well, one of the big initiatives from CDC is networking collaboration across the board, maximizing resources. And in order to do so, we have to collaborate with existing entities and agencies in the county without having to duplicate services and do the same thing from one organization to another. We can all group together and maximize everything we do in a joint effort. And we do collaborate with AIDS Outreach Center, Planned Parenthood, MHMR, Samaritan House, and other organizations in order to ensure that we are getting as much of an impact and reach out in the community as we possibly can. That is going to improve even more so with the initiatives of train-the-trainer style initiatives and interventions that are going to be pushed in the next grant cycle in order to get the word spread out even more by facilitating individuals who can disseminate the information with fidelity across the county in a more effective manner. And that means developing new collaborations with people that we may not have thought of beforehand. So we are constantly looking at who we can get in touch with, bridge some relationships with, and hopefully get the word out in a more impacting and beneficial manner.
It is still unfortunately true that the incidence of AIDS and HIV has gone down in some communities and gone up in others, particularly in the African American community. The numbers continue to rise and to be astoundingly high. What is the Public Health Department doing to reach out to that community, to educate, to intervene, to test? What's going on?
That's where we have to look at interventions that are targeted towards specific ethnicities. You can't do a general public health message expected to impact every single community and or gender and or ethnicity, because if it doesn't apply to those individuals, they're not going to hear it. You have to make things tailored to those audiences and tailored to those people. And that's what we're looking at down the road, is having interventions that are specific towards certain populations so that you can hopefully get them to first give you an audience, listen, and then start to make those changes. So that means actually changing our modality of how we provide these interventions on a blanketed effort and actually looking at specific communities where we can get in with gatekeepers, with community leaders, and hopefully get them to buy in, and then from there give us access to those populations and hopefully make much more of an impact than we could just with a generalized message. I also would like to see more targeted social marketing. I'd like to see messages that are specific to target populations that they can actually relate. And in order to do so, that requires breaking down some of these stigmas about what we advertise, how we say it, what we do in the community in order to get those messages out. Because if we just use certain broad information, it's not going to make the impact that we really need among certain target populations.
Well, I would encourage public health to focus more resources in this area, to work with organizations that are already beginning to penetrate these communities. I participated in a couple of events this past week that were hip-hop related and sponsored by the AIDS Outreach Center and a couple of other groups. We need to be working together and leveraging everybody's resources to make a dent in this, because unless we solve it across the board, then every community is still at risk.
Absolutely.
Thank you very much again for your presentation today.
Thank you.
Thank you.
Finally, members of the court, item C under briefing, this concerns the 2006 capital improvement program. Mr. Phillips is here to address the court at this time.
Good morning.
Good morning.
Good morning.
I'd like to update the Commissioners Court on the progress of the Civil Courts Building project. We opened the bids February 29th. The project team is currently evaluating the bids and meeting with the bidders, and that will go on for another 30 days or so, but I do have some preliminary information for you. What I have here is just some few notes in a timeline sequence, basically. And the first three items have actually happened already. Commissioners Court approved the capital budget for the project of $73.6 million last year. A couple of months ago, or actually last month, you approved the adding some project management skills to our project for $650,000 that got assigned to that particular Civil Courts building. And the only thing I haven't done is come back and requested to increase the budget for the project and increase it at $650,000, which I'll do in the near future. We received the bids for construction, as I mentioned. Now, the apparent low bids came in, you add them all together, came in at about $2.4 million over what we had hoped, which is about 4%. Now, what we plan to do is to get it below our original budget. And everything from where it says March and April 2012 is what we need to do to between now and then. We're going to need to rebid the earthwork as one of the initial packages. The earthwork bidders didn't include some of these subsurface drainage and things, so none of the bids are acceptable, and that is in the critical path of the project, which I'll get to in a minute. Also, it's a significant impact. We're going to need to redesign and rebid the courtroom millwork, the wood. We suggest, the architect is on board with this too, he suggested it. He's certainly at the table for cost reduction measures. Is in lieu of having walls on the side of the courtrooms that are fully wood, like we had planned and presented to court and was approved by court, we recommend going just with a woods wainscot, like we have at the Family Law Center and the Justice Center. Standard courtroom, we think we can save $500,000. It'll look nice, and the architect's on board. So we're going to be redesigning that particular trade package and rebidding that. Also, the drywall came in a little high, $500,000. We're going to revisit that, the scope of work, and hopefully get some additional bids and beat the weeds up a little bit and see if we can get some people who lower the price. But also, the construction managers, others are looking at reconfiguring some of the drywall work and design to lower the cost. Also, we're rebidding some of the door hardware, frames, and roof anchors and other small packages that will help us get there. Now, some other cost-reducing measures that we're going to be taking. The interior stone, which is in the lobbies and also behind the benches in the courts. As that stone was a marble and was 1 3/4 inch thick, we recommend, this came from a voluntary alternate from the bidders. So just go with a thinner stone. The architect was okay with that. Go with a much thinner stone. We might can save $400,000. So we can certainly look at that. Also, we'll be making some changes in the HVAC mechanical system, hopefully save another $150,000. And we're discussing some changes in materials and different systems regarding the glazing and the building and the carpet and things of that nature. Now, if all of that doesn't work, we're going to suggest to court that we go ahead and take some of the deductive alternates that were bid. We purposely bid in this project. Some of those, for example, is to completely remove the wood ovals that are in the ceiling of the courtrooms. If you remember the alien eye that we had once, we removed it already, but there's still a wood little oval in there that we left. The value of those is $128,000. If we take them out, the architect, again, is fine with doing that. Also, there's 3 others listed as far as simplifying the lobbies, possibly changing the granite pavers to brick if we need to, and if we don't, that's fine as well. I will be back on May 1st or May 8th with a guaranteed maximum price for $56,500,000 or so, which is what we approved as part of the overall $73.6 million project. I will be back in the 1st of May. Now, after that, the construction managers will provide a performance bond, the surety will, and that'll take a few days because they require a contract before they're going to write the bond. That'll take a few days. Then we issue notice to proceed. At that point, we can have a groundbreaking and those things, and the contractor can go to work. However, the only fly in the ointment there is the earthwork contractor. That's really the first horse out of the gate, and we're going to rebid that. That rebids, it advertises this Friday, and it'll be on the street a minimum of 2 or 3 weeks, and see if we can get some bidders in here that we can get the complete scope of work. And that may make us not actually start turning dirt until late May or June. But they'll be mobilizing on the site in May after we issue notice to proceed. We'll be moving Yates and Vendime, their construction executive type offices, support offices will be in our 300 West Belknap building on the 2nd floor, the old jail. We currently have Gilbane nested in there on the 1st floor, and we'll have Yates on the 2nd. That'll be kind of interesting what goes on in that building. It's a good, cheap space right now. Since we have to have the building, we have to have air conditioning on in the building, which it doesn't cost too much for that incremental cost. Also, on the very last bit of information I have for you, Court of Appeals. The Court of Appeals is not included in anything I've just discussed. If we want to finish out the 6th floor for the 2nd Court of Appeals, the additional cost is $3 million. And that includes the construction cost, which came in, which was bid at approximately a little over $2 million. That includes furnitures, fixtures, and equipment, moving, IT, all those costs related to delivering the space. That's all I have this morning.
Couple of questions. One, the earthwork rebid, are we rebidding that because there was misunderstanding in kind of what was there in the first place, or are we just saying we don't like your bids, go back out and give us lower bids?
Misunderstanding of the bids. It looks like the three bidders should have all included the subsurface drainage work, which is the trenching work, really. It's below when they dig the hole. They've got to do a lot of things. They dig the hole, put the stabilization, reinforcement around the walls, and they start digging trenches and put subsurface stuff in and stuff like that. They just didn't include some of the piping. None of them did. They didn't catch it up on some of the other pages. In the there's 400 or 500 drawing pages, and it's a complicated set of drawings, and they didn't pick it up.
So the likelihood is we're not going to get a lower price when we go out for the earthwork. We're going to get a higher price.
Correct.
So that's going to...
All this is factored in. My goal is to get you a project that's come within the $74.25 million.
Does the 74.2, does that include monies that we had left over from the Family Law Center when we did that bond? And, because originally we had thought about that being a family law civil courts. We didn't do that. I thought we had about maybe $6 or $7 million left over from that.
I do have that breakdown. Basically, and maybe Debbie should be a better person to answer this, but it does include the interest earnings off the 2006 bond package. It includes some TIF money, some lease payments that we've been paying off of the parking. And I don't think we plan on selling any additional bonds. There's $7.5 million worth of bonds left available from the 1998 bond package that we do not plan on selling for this project.
So that means...
So the answer to your question is that there is money left over, but we don't anticipate using it as far as selling new debt.
Okay, so let me ask that question a different way. We have you showing a budget of $74.2 million. Is that budget based upon, what did we originally say in the bond package that we were going to spend on that bill?
Only one copy. Voters approved in the 2006 $62.3 million. Then we 62.3.
So to that 62.3, we're adding accumulated interest from almost 2.2 million on the, I guess, 1999 obligation bonds, about another $5.8 million worth of interest off of our 2006, and about 3.3 off of our cumulative TIF contributions coming off of the garage.
Yes, sir.
So in 1999, I think is when we did the Family Law Center, we actually had approved $7.2 million more than what we spent for the center, because at that point we originally thought it might be a civil family court building.
Yes, sir.
So as I'm reading this, the 73.5 or 6 does not include the remaining however many million we had off of the 7 point something, I think is what you said a few minutes ago.
Yes, Judge, that's correct. Those are unsold, and as far as we can tell, they do not have to be sold to deliver this project.
Well, it depends upon whether or not, and if we can value engineer down to this, then we don't have to sell it. If we don't, then we might have to sell some of those bonds in order to build the building on that basis.
Well, my plan is to get.
I hear what I understand what you're.
We will get it down to the number I gave you just a minute ago.
Well, and I guess the question, though, and I appreciate you saying you will get it down, but if you make sacrifices to get it down that we don't like, then you won't get it down. So, I mean, I think we've got to understand what, you know, I think we all want to see it gotten down to that point, but we don't want to see it gotten down to that point if it means taking something from the building that we really want in there.
And I think the only thing that might have some, the emotional part of it would be the very last things on the second page, that things that we have put numbers on and bid as deductive alternates that may not have to be taken. It's the items regarding the wood ovals and the lobby ceilings and the brick pavers and the county seals on the exterior of the building.
See, I'd kind of like to keep the county seals on there. And
well, I would too. And I think I was talking to the project team yesterday at length, and they think, if everything goes well, and they think it will, that we won't have to take any of those. We just need to rebid some of this stuff.
And I very much appreciate the way you're working at this. I mean, I don't want to discourage you from doing that. I just want to be kept in the loop as to what we're cutting to get to that point. So in case we decide we really don't want to cut that,
Yes, sir.
then we're.
Here, my plan is, Judge, is to come back to you May 1st or 8th with a guaranteed maximum price for $56.5 million, thereabouts. And some of that's millwork and things won't be bid yet. Matter of fact, the design of it, as far as making the wainscot and things like that, won't even be finished. It won't be bid. So we're going to be putting allowances in, or the construction manager will, putting allowances in for those trades. But that is the guaranteed maximum price. And they're not going to be putting any allowances in for those things like the county seals and the brick and the granite pavers and things. However, if the bids come in for the millwork and the drywall and things, they just can't get to the number we want, I will be back up here discussing it with you.
David?
I think that, excuse me, go ahead.
Oh, okay. Again, originally, this was a $66 million project, and that did not include the sixth floor. Is that correct?
The original project was a $62.3 million project, and it was a smaller building, like 180,000 square feet or so. And then we got to doing the programming and needs and looking at the overall master plan for downtown Fort Worth, our campus, talking about moving civil courts, the Court of Appeals,
Right.
and things of that nature. So we thought it was in the best interest of our overall master plan is to provide at least a shell space for that, and that has a cost. And that added a floor.
So that's part of the reason we
part
went
of it.
from 62 to 74.
And part of it is we decided to go ahead and move forward with the jail and medical examiner first, and we had some delay regarding starting the civil courts, and that may have something to do with it too. I don't know, but we have got to the point. We've got a little bit bigger project. Our project size now is 234,000 square feet.
Well, that's a substantial change
Yes.
from 180.
180 to 190 is what we, and we put those numbers together, Commissioner, back in 2004 and 5 when we start planning for the bond package. Those are the things we put together back then. So by the time we start this, it'll be almost 10 years since the time we planned it.
Commissioner Brooks?
My comment was going to be that the 2,000-pound gorilla in the room is not the $360,000 or $70,000 worth of cost under item number 3. It's the $3 million for the Court of Appeals. I am convinced that, based upon what Mr. Phillips says, that we can bring this project in under the $74.25 million price tag. The question is, what do we do about the Court of Appeals? What are the ramifications of leaving them where they are and not spending this $3 million, which would undoubtedly cause us to have to sell that additional debt?
I'm thinking, if I may, I'm thinking as we move forward with the civil courts, and about halfway, through the project, through the construction, we come back to Commissioners Court and look at a programming and space needs assessment for the criminal courts system in downtown Fort Worth campus. And that really is the Tim Curry building, is what it's about. We've always talked about moving folks out of the old 200 West Belknap building, the 1917 model, moving them out of the old jail building, consolidating some of those CSCD and other support and DA folks, DA staff, back into the Tim Curry. You know, because things are going to change a lot when we move those civil courts out. And one thing would be on the 9th floor, where the Court of Appeals is, in theory, it'd be best to probably go ahead and repurpose that space for the district attorney's office. They already have half of the floor anyway. And do some of that, reconfigure probably some of the court floors, provide some additional holding cell space. We've got a whole little laundry list of things that we would do in a programming exercise, a space needs assessment, which will cost about $500,000 to do that, because it's a very, very detailed process with designs and floor plans and stuff. But that would be a year and a half or 2 years from here. But it will, naturally, it would probably cost us more to go buy it out later, and we'll be doing it in a building that's occupied in the civil courts building. Now, we did that in the space they're in today. We put in an exterior elevator outside the building and did it that way. It cost us about $2 million to build out that 9th floor, and that included the DA space. And they have about half the floor. Can be done. Is it clean? It's not very clean, but it can be done later.
Other questions? One other thing, I know you've been digging out here on our sidewalk, and I know you're getting the chiller ready and moving that over, electrical coming over. When is that styrofoam building going to be ready to come down?
I will be back up here in about 2 months, 2.5 months or so, and hopefully telling you that the chill water plant is operational that serves the historic courthouse. And at that time, I will probably come up here and ask for $5 million to go ahead and bid to take the building down and to restore the west elevation. I think that's what it's going to take. We already have bought the granite, about $1 million worth of granite we have at our facility, so that's been done. It'll take about 2.5 to take the building actually down, to do it in a surgical demolition manner, and it'll take another 2.5 to build up the foundation and to restore the west elevation, get all those 400 to 500 pieces of granite back on the end of the building. So the drawings, Judge, are complete. We've already paid for a set of construction documents. We need to take them back down to the city of Fort Worth to get them updated because they have changed their building codes recently. So we'll have to probably pay some more to get that done. But we're going to be ready to go.
Clock tower? It's looking good.
It is looking good. The coppersmith's he's having some issues. He's doing the right thing. He's taking his time, and it's taking him a long time.
The two folks, as we get closer to the end of this deal, I know there's a lot of people to recognize because a lot of people have worked very hard on, restoring that and doing that. But the copper person, the clock person, I hope we get to thank those folks in court as we move.
I'll have him here when we do that. And this Art Wyman brought up, we would like to recommend that we install a plaque, of course, for the elected officials somewhere in the building going up to the attic or to the tower, because it's really not a public area. And also somewhere next to that, possibly a plaque for the workers on this project, something that's very proper as far as all the people who, the iron workers and the painters and the coppersmiths, all those folks who have done a great job.
I know we don't have a whole lot of room in that little room off from the entrance, but that might be the place to look at something like that and recognize those folks because they've done a fantastic job.
They did. And that's all I have this morning.
When will the scaffolding start?
Well, it was supposed to have already started coming down, and they've got they call them bulldozers on the edge between the clocks and the dome. They've got it installed, and I thought that'd be last week or so, and then that happened, so I'm afraid to put a date on it, but it'll be soon.
So if you want to go up to the top,
There you go now.
You've got a limited period of time to get up there and get a picture with you and the fennel up at the top of the deal.
The inside looks good. They're redoing it, and they're finishing up on the inside, and it's really impressive. Thank you.
Thank you.
Thank you, David.
Thank you.
You want your schedule back?
That's all we have at this time, Your Honor.
You will now recess our open meeting and proceed to closed session to discuss items exempted under 551.071, 072, 074, 076, and 087 of the Texas Government Code. Having returned from our closed session, we'll now address the following matters.
Under item 8D, the District Attorney's Office requesting authorization for the District Attorney's Office and Human Resources to enter into negotiations to terminate the contract that we have for certified workers' compensation healthcare network with Dallas County Schools.
Second. A motion is second. Any discussion? Please vote. Motion passes unanimously.
Thank you.
There being no further business, we're adjourned.